I had a patient this week who came in, another one of my very educated patients who came in, and she had a tooth extracted, and she came in for a consultation regarding placing an implant, and also was telling me about a lot of the other problems that she was having from, and she's a physical therapist, and she was having problems, muscle problems, neck problems, and things were out of whack, and she was suffering, and she had a lot of the answers herself, being quite educated in that, being her discipline. And we started talking about sleep disordered breathing, and she understood, connected. She understood, and I gave her some information to read. But ultimately, you know, she had gone through orthodontics, and her teeth were crowded, and I could see a lot of what I call the structural markers for sleep disordered breathing. Doesn't mean you have it, but there are risk factors that may suggest that perhaps it's prudent to do a screening. And at the end of the day, with this particular individual, I think it would not be advisable to place an implant until you really address the structural aspect as it pertains to her airway. Because once you place an implant, it's not moving. And if she's going to go through a procedure to develop her airway via changing her skeletal structure, facial skeletal structure, it would just be an impediment to that. So we have to be able to see the trees within the forest. We have to be able to really step back and look at what is in the patient's best interest long term versus let's just go ahead and schedule a procedure. And I think that is very rewarding if you can actually look at the overall picture and educate the patient. And it may take some time for the patient to get there, but at least they understand. And most importantly, you're doing no harm.